Hello everyone, how are you? So, what will we learn today? Our today's topic is Listeria monocytogenes. It's a very interesting bacteria. So, don't let's start. First of all, we have to know how it can enter into our body. So, there are some foods which are very risky for your health. They are raw sprouts, raw milk or unpasteurized milk, soft cheeses, smoked seafood, deli meats, hot dogs, and especially they have to be cold, not heated. Okay, because the listeria have the tendency to grow in a cold temperature, specifically 4 to 80 degree temperature. So these foods are very risky for your health. So this is a figure showing how a Listeria monocytogenes looks like. This is a foodborne pathogen, and it infects humans as well as animals. And they have the ability to cross our placental barrier, blood-borne barrier, intestinal barrier, and they grow in low temperatures in cold environments, 4 to 8 degrees Celsius temperature, acidic environments, high salt concentrations. Okay, now so this is a figure of actually this is as it is in purple or violet color, so we can clearly say this is a gram positive rod, okay, arranged in V or L shape. So this is a very important property. This is a gram positive rod arranged in V or L shape. Okay, now, this is a figure of the culture, and this culture is done in blood agar media. And in blood agar media, a narrow zone of beta hemolysis is produced. We can see this narrow zone of beta hemolysis, and it indicates this is Listeria monocytogenes. Okay, so the second property, this shows a narrow zone of beta hemolysis. And it's a figure of how catalyst positive test is done, and this kind of bubble shapes are formed in a catalyst positive test. So Listeria monocytogenes is also a catalyst positive. Okay, so now this is a video. Okay, I'll play. Okay, why actually what what kind of movement we'll see in this video? This is called a very special movement. It's called tumbling movement. So why this movement is important? Because as we saw, a gram-positive rod is shown, but gram-positive rods is very similar to corynebacteria. Okay, so how can I differentiate between corynebacteria from Listeria? This tumbling motility or tumbling movement is the very important property that can distinguish it from corynebacteria. Okay, this tumbling motility is only seen in Listeria monocytogenes. So how it looks like, just see. This is called tumbling movement. Okay, just to see how they're moving, just amazing, right? Okay, so very important properties, tumbling movement. Okay, now, so what have we learned? Their important properties. So first of all, small gram-positive rod arranged in V or L shaped. Okay, tumbling movement. Okay, narrow zone of beta hemolysis. Okay, and cold enhancement. Okay, and there's some other properties like they are aerobes and facultative intracellular. So these are less important actually. Okay, so now what will we learn? So now we have to know who are the mostly affected by Listeria monocytogenes. We can divide it into three groups. Okay, as we you can see here, this is the newborn baby. Okay, this is actually it's not actually a newborn baby. Just suppose it's a newborn baby, and it's a pregnant mother, and it's an adult. Adult actually, we should say immunosuppressed adult or actually oldest person. So these three groups are mostly affected by Listeria monocytogenes. So now, so it's a very important part. Now we learn about the pathogenesis. Actually, Listeria infections occur primarily in two clinical settings. One is in the fetus or a newborn as a result of transmission across the placenta. or during the delivery. Okay, this is the first clinical setting, and the second one is pregnant women and immunosuppressed adults, and specifically renal transplant patients. Okay, so why the pregnant women are actually so risk of Listeria monocytogenes? Because in pregnant women, cell mediated immunity has reduced, specifically during the third trimester. Okay, so they are prone to this Listeria infection. So now, actually, how this kind of invasion occurs? The answer is the pathogenesis of Listeria depends actually on the organism's ability to invade and survive within the cells. And this kind of invasion of cells is mediated by internalin made by Listeria and E-cadherin on the surface of immune cells. So we will memorize these two names, internalin and E-cadherin. Internalin is produced by Listeria and E-cadherin is the receptor that is situated on the surface of human cells. Okay, so actually now there is some kind of interaction between internalin and E-cadherin. So just we'll watch a short video. Let's start.
Crossing of the intestinal barrier starts by the interaction of the bacterial protein internalin with E-cadherin, a human-specific receptor accessible in the lateral region of these cells. After binding to the cell, the bacterium is internalized, rapidly transcytosed and released in the lamina propria and into the bloodstream.
Okay, this is a very actually I mean this seems to be difficult to me how the interaction of internalin and E-cadherin occurs. But this is a small, just a short video. If you can get some idea from this video, actually I'll be very pleased. Okay. Upon entering the cell, the organism produces some special things which is called listeriolysin. There's a video, maybe it will be shown later, the listeriolysin O, and it allows it to escape from the phagosome into the cytoplasm. Okay, so we'll memorize the name listeriolysin O, which allows it to escape from the phagosome into the cytoplasm. Okay, now how it can move from cell to cell? This is a very important question, and the answer is actin rockets. So what I'm saying? Actin rockets. What is actin? Actin is a filament. These filaments of actin polymerize and propel the bacteria through the membrane of one human cell into the another. Okay, so this is also a video. Just let's see.
Inside cells, the bacterium covers one of its poles with Act A, a bacterial factor that recruits small actin
This is actin
filaments from
filaments.
which
Okay,
other actin
just see
filaments
how they are
rapidly grow
moving
to
from
form
one
the
cell to
distinct
actin.
comet tail of the moving bacteria. The actin-propelled movement of the bacterium enables it to push the cell membrane into that of a neighboring cell.
Okay, so we'll memorize this name actin rockets, by which it can move from cell to cell. Okay, before I was saying that listeriolysin O. So now this is listeriolysin O.
At the level of infected organs, Listeria has the powerful ability to alter host cell physiology
How
before
listeriolysin
it
O is
enters.
produced.
The
A.
bacterium
This
starts
is
this
listeriolysin
process
O.
by secreting the toxin listeriolysin O.
Okay, listeriolysin O, and there will be various kinds of mechanisms, and thus they can escape from the phagosome into the cytoplasm. Okay, now the most important clinical findings. So clinical findings, we can first of all we should know about pregnancy. Okay, during pregnancy it can cause abortion, premature delivery, sepsis during the peripartum period. Okay, as well as pregnancy, the newborns are also affected by Listeria monocytogenes, and they can produce newborn meningitis. Meningitis can also be produced in actually immunosuppressant adults, but actually newborn meningitis are very common, and sepsis can also occur. And the third one is gastroenteritis, and gastroenteritis is characterized by watery diarrhea, fever, headache, malaise, and abdominal cramps, but little vomiting. Again, I'm saying vomiting is very little. Okay, vomiting is very little. So actually, this gastroenteritis is self-limited, and generally no medication is needed for it. So, just three things we can memorize: sepsis or meningitis, abortion, premature delivery, or sepsis during the peripartum period, gastroenteritis. Okay, now, so there are various kinds of disease they're producing. So, what are the treatment? How can I treat the patient? The answer is what? Ampicillin. So just memorize these antibiotic ampicillin. Ampicillin, okay? Ampicillin can be given with or without gentamicin. Sometimes trimethoprim, sulfomethaxole can also be used. Okay, but we shouldn't memorize this hard terms. Just we have to know ampicillin. Ampicillin is the basic treatment. Okay. Okay, so actually, we're coming to the last part. Now, this is a quiz for you. So, let's see. What is the quiz? I'm reading. A 23-year-old pregnant female is brought to the emergency department due to nausea, vomiting, and diarrhea. Several hours later, she spontaneously delivers a preterm infant who has meningitis. Upon further investigation, the mother endorses regularly drinking unpasteurized milk throughout her pregnancy. Blood cultures from the mother and the child reveal gram-positive rods that exhibit tumbling motility in broth. Which of the following would be most useful in eliminating the causal organism? Option A, cytotoxic T cell activity. Option B, antibody secretion. C, complement activation. D, safe tracks. So, actually, first we have to find out some keywords. I'm using a pointer. Okay, no, I'm using a highlighter. Okay, the keywords are first of all nausea, vomiting, diarrhea. Okay, then meningitis, then unpasteurized milk, then gram-positive rods, then tumbling motility in broth. Okay, all of these features indicates one and only Listeria monocytogenes. So the answer is A, cytotoxic T cell activity. Okay, so what is the answer? Cytotoxic T cell activity, as this indicates, and the causal organism is Listeria monocytogenes. Okay, so I think now I should end the lecture. Actually, it's just not a lecture, just a short overview of Listeria monocytogenes. I hope that you are enjoying my videos. So thanks for watching. Bye bye.